Due to the impact of Typhoon Guni, or locally known as Rolly, the CERF through the UNICEF and a single drop for safe water have mobilized resources to form an emergency response, particularly on the wash sector. For this response, UNICEF and a single drop for safe water directly work with the province of Catanduanes and 4 of its MLGUs heavily affected by the typhoon, namely Baras, Bato, San Andres, and Virac. There were 6 main areas of intervention for this response. Solid waste management, example is awareness raising on proper hygiene practices and water quality monitoring. The support for the WAS cluster coordination, of course, and the water kits distribution also happened. Provision of hygiene, water, and COVID kits. The construction or rehabilitation of water facilities of Catanduanes also happened. The most appreciated interventions were the supply of water and hygiene kits and sanitation materials, repair kits, followed by repairs, new water system, and equity support for sanitation. Offered also water quality monitoring training using PML kit. The response that was from December 15, 2020 was culminated in May 15, 2021 with the following result. At least 44,305 individuals were recipients of at least one intervention, the improvement of community water facilities. Communal toilet and bathing cubicle, communal septic tank, and more than 75% of communities retain the key hygiene messages and practices based on the post-distribution monitoring survey. Improve also the health center wash facilities. During response also, materials recovery facility had been constructed. After the Typhoon Rolly emergency response, UNICEF's discussion with the provincial government of Catanduanes has sparked interest at the highest political levels for increased investment in the wash and nutrition sectors. And the LGU realizes that with improved capacity, it can leverage this into a progressive development at both the municipal and provincial level. This is also validated by the response from the communities and the LGUs at the municipal level, as ASDSW conducted exit activities at the end of its typhoon response. Because the ASDSW's governance and phased approach to sustainable sanitation or PATS program has been successfully implemented in 3 provinces, a city, and several municipalities throughout the Philippines, it worked with UNICEF and the Latter-day Saints Charities of the Church of Jesus Christ of the Latter-day Saints to propose the Catanduanes Wash Program. The program aimed to increase investment in wash services, as well achieve a large-scale reduction in open defecation by building effective governance systems in conjunction with behavior change programming to not only make the requisite changes within the households or governmental systems, but to increase demand for improved wash services and behaviors to make the changes more sustainable. The program entails working with the PLGU and 4 municipalities to create wash governance structures and institutionalize these structures, develop strategic and investment plans, develop specific strategies for specific issues, build institutional capacity for implementation of the PATS policy, coach implementation of PATS, coordinate and harmonize activities with other future activities, specifically UNICEF-funded anticipatory action, and hand-washing intervention. Conducted also Global Hand-Washing Day launching, poster-making contest. Caravan also happened. Battle of the Bands, construction of hand-washing kiosk. At the end of the intervention, the PLGO realized that it would have a better impact if covered the entire province on its PATS implementation. Thus, the expansion of the PATS implementation to expand coverage of PATS to the entire province. Recognizing that in order to sustain the initial efforts, the program also needs to consider the strengthening the governance of the remaining 7 MLGU. Thus, the governance and PATS was again added to increase the level of impact of the program. It is also during this time that the committed sanitation subsidy of the province was finally disbursed and the provincial PATS COD ordinance was passed.